Our understanding of the origins and categorisation of heritable hypermobility has undergone a significant shift over the past 3 years, which I will now briefly outline, as your understanding of the origins and complexity of this disorder is important. Hypermobility is one of 200 disorders of the connective tissue. These are a group of genetic disorders affecting connective tissue protein matrix. The genetic abnormality or variance of the connective tissue can go undiagnosed. However, it can lead to biomechanical abnormality, biomechanical defect, tissue laxity, fragility and mechanical failure, which is why it needs to be understood in the dance environment. This disorder is still not fully understood. However, in light of a large consortium of medical experts in the field in 2017, we now have a clinical update and clearer understanding of the connections and idiosyncrasies associated with hypermobility as a heritable connective tissue disorder. So let us look closer now at these heritable connective tissue disorders. We can see within the 200 disorders on the left, there are a group of 13 disorders called Ehlers-Danlos syndromes, which we will discuss in a moment. What are common to all of these disorders are the hypermobility spectrum disorders, otherwise known as joint hypermobility. Within these there are 4 different disorders: localized, peripheral, generalized and historical joint hypermobility. Now let's take a look at the spectrum of hypermobility disorders. These are observed as an excessive range of motion in a joint, taking into consideration the age, gender and ethnic background of the individual. Joint hypermobility can be localized, peripheral, generalized or historical. Localized joint hypermobility is limited to 3 joints, and peripheral joint hypermobility is limited to the hands and feet. Generalized and historical joint hypermobility affect both the limbs and the axial skeleton, and are therefore predominantly and often misconstrued as an asset and signposted towards a dance technique because they facilitate an excessive range of motion. Generalized joint hypermobility can be asymptomatic. However, it can cause problems within the musculoskeletal system because of the tissue fragility. And these can occur during developmental stages that are critical to dance training, for example, during an adolescent growth spurt. Generalized joint hypermobility is therefore something that dance practitioners should be aware of when training dancers, as the fragility of the connective tissue in the joints makes them vulnerable to injury. The connection between generalized and historical hypermobility is that the joint hypermobility decreases with age and skeletal maturation, and therefore someone who has generalized joint hypermobility may not present with the flexibility they once had. So this is screened retrospectively. The spectrum of disorders are the most common of all hypermobility disorders. They have overlapping features that are common with other heritable disorders of the connective tissue. They are not life-threatening, however they can carry the greatest burden in terms of pain and disability. The prevalence of joint hypermobility is difficult to estimate and ranges in the literature from 10% in European populations to 25% in other ethnic groups, and is more common in females with a ratio of 3:1. Young et al. In 2019 provide a figure of 18% for an adult population of 46,000, and they use the retrospective historical joint hypermobility questionnaire. The estimation for joint hypermobility prevalence is challenging because it's not typically screened for, and only really registers within a health reporting system when something within the musculoskeletal system goes wrong or fails or becomes problematic. Reporting generalized joint hypermobility is, however, also influenced by lifespan development, maturity and injury, again making it more difficult to be reported. Now let's take a closer look at the Ehlers-Danlos syndromes. These are also hereditary connective tissue disorders and all present with joint hypermobility and extreme flexibility. Prevalence for these disorders is estimated in the early literature to be 1 in 5,000. They range from mild to life-threatening disorders. The most common one seen in dance is the hypermobility type, hEDS, which can again seemingly present as asymptomatic and therefore can be missed. Because of this, it does find its way into the dance environment. It is also the only one of the 13 disorders that cannot be identified by genetic coding and is diagnosed through observation alone and can therefore be missed. As dance practitioners, we aren't qualified to make such diagnoses. However, we need to be aware of the disorder and the implications of it in our practice. Currently, clinicians consider that hEDS is underestimated. It was formerly known as types 1, 2 and 3 of hypermobility and presents with extreme joint hypermobility and flexibility and may have overlapping characteristics with what we now know as generalized joint hypermobility, to the point that they have in the past been considered the same thing. This has caused a lack of clarity and confusion when reviewing the literature. Castoris suggests that hEDS can afflict up to 2% of the population. hEDS is defined by its association with generalized joint hypermobility, joint instability complications, widespread musculoskeletal pain, and minor skin features. hEDS is commonly recognized by the revised Brighton criteria. Before we move on any further, I'd like to point out one of the more extreme heritable disorders of the connective tissue that can present itself as seemingly asymptomatic and may also find its way into the dance studio and even professional dance. And anecdotally, I have worked with a dancer who clearly had Marfan Syndrome and at the time did not know. Marfan Syndrome is one of the most extreme heritable disorders of the connective tissue and is diagnosed using the Ghent criteria. As well as joint hypermobility and extreme flexibility, Marfan Syndrome has clinical characteristics that include long bone overgrowth and problems with the cardiovascular and ocular systems. This would normally make inclusion into a professional dance environment unlikely, although not impossible. If we look at this schematic, we can see a typical Marfan Syndrome body type. The long limbs and short torso are reminiscent of body types that have in the past been coveted by choreographers such as Balanchine.